Facial rejuvenation has changed a great deal in the recent years. Our concept used to be that for an aging face, we just needed to pull the skin tightly. The problem with that is that it gave a lot of very unnatural looks that you'll sometimes see walking around. So we've changed it radically since we now understand that facial aging is really a combination of two factors. One is what we call deflation, where fat will actually reduce in size, so the face will more or less deflate like a balloon. And the other is the gravitational change that comes with things dropping. Things such as the fat falling into the folds, the fat falling down into the jowls, the fat falling into the neck, and the muscle banding. Now, whenever we go about correcting this, when we speak of deflation, we're thinking in terms of filling things up again. We might inject fat, we might inject other fillers. As far as the gravitational changes are concerned, we're dealing with lifting. If it's just fat that's dropping down, we can do something called an endoscopic facelift, where we make a small incision in the hair and we go down beneath with an endoscope, actually bring the fat from the cheek back up and the jowl back up, all done with just a small incision here. It's a wonderful way to do things. In many other cases, though, there's also some drooping of the skin as well. In a case like that, we need to make some well-concealed incisions about the ears, lift the skin up, and actually bring the fat back up into position, tighten the muscle, and remove some fat as needed. In some cases, we use very short incisions, but if there's a great deal of skin to remove, then we're going to need to use a longer incision. But in either case, they tend to be beautifully concealed and heal very, very nicely. Well, after we've done all of that, we still are dealing with the skin. You may have wrinkling of the skin, and if we've done, say, a full facelift, we can still do laser resurfacing around the eyes, around the mouth. And if we're not doing any type of lifting at all, then we can address the entire facial skin by doing a full face laser resurfacing. Now, in the past, those laser treatments were always done under anesthesia. They had about a week-long recovery, and the results were very dramatic. But very recently, we've been able to achieve results that are almost that good with other types of lasers, where there is absolutely no anesthesia involved other than some creams which the patient applies an hour beforehand. The treatments are done as an outpatient. The patient drives himself home. The following day, they look as though they have a mild sunburn, and the following day, they look absolutely normal. And after about 4 of those, you're going to get almost the same type of result as you would get with a full face laser resurfacing.
I'm a great-grandmother, and I was beginning to look like it and showing my age, so I came to Dr. Sanders for a facelift, and I've been so pleased with the results. I never had a bit of pain, a little bit of bruising for a week or two, but other than that, it was just a wonderful experience, and I would do it again in a heartbeat.
I started looking around, and I did about a year research, and I went to some doctors, and I couldn't believe what they were going to do to me. I was just going, oh my God, I just got to run out of this place. And then one day I met somebody that just looked so natural. I said, where did you go? And she goes, I went to Dr. Sanders. And I go, who is this? Give me the name. Please give me the name. And I came over here, and I walked in here, and I felt so at peace and everything. And Dr. Sanders goes, you don't need a lot. You need a little bit. Dr. Sanders is just so good, so kind, so well-mannered, and so professional. And I have to emphasize professional, because this whole office gave us nothing but the best, and I couldn't be more happier with everything. I feel young. I dress differently now. I act differently. My neck is up. No more neck.
I know another